Welcome to Recovery Coast to Coast, broadcasting from Clear Channel Studios in Seattle, Washington, carried live on Fox Radio 850 KHHO in Tacoma, Washington, and carried nationally in streaming audio at www.recoverycoasttocoast.org. 2 hours of interviews and features, plus questions and comments about this one-day-at-a-time adventure in personal recovery as we share experience, strength, and hope with others so that they may recover from alcohol and other drug and behavioral addictions. And now, Recovery Coast to Coast is on the air. Here's your host, Neil Scott.
Welcome back, everyone, to Recovery Coast to Coast, America's nightly voice for recovery, on the air 5 nights a week, 2 hours a night, talking about addiction with a focus on recovery. We are delighted to be at the 40th annual, that's right, 40th annual NAADAC conference. NAADAC is the Association for Addiction Professionals. They meet all over the country. This year, they happen to be just outside of Seattle, right down by the airport. Our broadcast in this particular segment is being brought to you by Eve Ruff, CEO of Residence 12 for Women in Kirkland, Washington, where recovery is reality, residence12.com. They also have a bookstore here at the conference. My friend Carolyn runs the bookstore, and I was just down chatting with her, and she said, there's a woman that you really need to get on the show. And she showed me a book called Sexuality and Addiction, Making Connections, Enhancing Recovery. Raven James is the author of that book, and I tracked her down, sent her a text, and by golly, here she is. Raven is a sexologist, researcher, consultant, and assistant professor in addiction studies at Governor State University in Illinois, a great, great state of Illinois. She has worked in the substance abuse field since back in 1994. She's a trainer. She's done case management, and her published works include several peer-reviewed articles on her sexuality research and contributions to Prager's multi-volume series, Sexual Health. And you're involved with a couple of organizations you were telling me about. Yeah. Welcome to the program. Tell us about those organizations.
Oh, sure. I'm the board member for NAADAC, which is the National Association of LGBT Addictions Professionals and their Allies. NAADAC.
We have so many alphabet soup.
I know, I can't keep track of my acronyms.
Acronyms Anonymous or something. Okay.
We like to make up a few of our own as well.
That's right. I belong to a 12-step program for a talk show host called On and On and On and On and On.
Oh, boy.
But I digress. And another organization you're involved with is
INCASE. I'm also on the board of INCASE. INCASE stands for the International Coalition of Addiction Studies Education.
That is a mouthful, Raven. Raven James joining us tonight on Recovery Coast to Coast here at the NAADAC conference. Sexuality and addiction, making connections, enhancing recovery. I like the term enhancing recovery. I don't even like to use relapse prevention. I like to use recovery enhancement. We should be getting better. We should be doing more things to make recovery even greater. Talk about the premise of the book and how it came to be.
Well, when I worked in the field, first worked in the substance abuse field in the 1990s. I graduated from Binghamton University with a bachelor's in applied social sciences, which is a pretty liberal degree. I went to work for an AIDS organization, and at the AIDS organization, I was an HIV coordinator. And I worked for OASIS, which is the office, another acronym, the Office of Alcohol and Substance Abuse Services.
Oh, yeah.
So what I did for OASIS was I provided client education, HIV education, to people in treatment centers, and we had a 8-county catchment area that we worked in upstate New York with 28 OASIS licensed agencies. I also provided education to counselors in the agencies around HIV confidentiality law. I was a master trainer for OASIS as well, doing 2-day trainings on HIV and STI counseling issues, dying and death, and working with lesbian, gay, bisexual, and transgender clients. One of the things that I noticed when I worked in the field as a case manager and an educator was that in the programs, sexuality was only addressed in terms of HIV prevention. And there are a lot of other links that I saw from some of my own personal experiences and then with the people that I was working with in the treatment realm that were linked to their sexuality that weren't being discussed in treatment. So we developed a 4-week sexual health group that we provided for women in a halfway house. And they were just so relieved that we were there. They said, nobody talks to us about this. Yeah. And they told us about some of the links to their use around, because it's a holistic approach to recovery. So it's a sexual health approach and looking at issues of body image, sensuality, how our bodies respond, sexual abuse, incest, rape issues, sexual identity, attitudes towards sexuality, intimacy issues. So there's a whole host of links to why people use and why they relapse that are connected. So that sort of drove my impetus with developing this program, and then I went to sex camp.
You went to sex camp?
I went to sex camp. Sex camp.
There's so many places I could go with that, but I'm not in the interest of good taste.
We won't go there now.
Yes.
We're going to go there, but in a different way.
Is there really a sex camp?
Well, we fondly dubbed it sex camp. It's actually a SAR, S-A-R, another acronym.
There you go again, Raven.
The SAR stands for Sexuality Attitude Reassessment. And what it is the one that I went to is a week-long training, 7 days of training. We're sexual beings from birth to death. You've noted that babies have erections in utero and vaginas lubricate, and we don't talk about childhood sexuality or give the proper names for parts, when we're teaching kids, and they don't have the terminology for basic anatomy. And so we learned about all these things from birth to death in a large group setting, small group setting, a lot of film. So it's a lot of experiential learning where we were examining how we felt about what the things we were learning about. And so we learned everything you wanted to know about sex and probably things you might not want to know about sex. But what it did for me was, it helped me to realize where some of the areas were that, for me as a counselor and a clinician working with my clients, and also how to help them, but also what I needed to work on. So I had unresolved issues around sexuality. I couldn't help my clients unless I had already done some work there myself. And recovery is a process. So when we first get sober, we first stop using, different things come up for us. And over time, over months and over years, some of these other issues that might be linked to why we used can creep up. And for some of the women that in the research that I've conducted who reported that they never had sex sober. And so if I'm one of those women who go to treatment, I've never had sober sex, but my counselor never asks me about my sexual behaviors and how they're linked to why I used or why I relapsed, getting into a relationship is going to be different for me, and it's going to be a big relapse trigger unless I have a way to deal with that, to realize it's like, okay, well, how do I deal with relationships? Do I have the language and the skills to negotiate, how to take care of myself around that? And so I also met the man who ran the human sexuality program at Widener University, and I commuted 200 miles one way to get a master's and a PhD in sexuality.
Holy smokes.
And with that, I've kind of moved to the point of conducting research.
The book is called Sexuality and Addiction, Making Connections, Enhancing Recovery. Raven James is the author. She's joining us for a few moments tonight on Recovery Coast to Coast. Is this book just for women?
No. Oh, actually, no. This book is for everybody. I wrote this book for a number of different reasons. First, obviously and foremost, for clients, for people who don't know, people who are affected by addiction, which can be clients, can be the counselors, because we have many counselors that are in recovery themselves. And it's for anybody who has been harmed by sexuality over the course of their lifespan. And we are a society that's sexually ignorant, it's sexually secretive, and we're sexually traumatized. And we are not socialized or culturalized to talk about it. And so that does us a lot of harm. And whether we're addicted to substances or not, we have harm that can be done to us based on some of the experiences that we've gone through. If I'm a female who has had multiple partners, there's a lot of slut shaming that happens in the culture today, where there's kind of that sexual double standard. And so what it starts to do is some of the links to substance abuse with sexuality, there's a salient factor of shame, this internalized feeling of being defective because of your sexuality, because of some of your experiences, and how people around you reacted. So whether it was messages that you received growing up from your family, if I'm gay or lesbian or bisexual or even transgender, getting messages from the church or from family members about that I'm defective as a human being because of that, and being psychopathologized through the American Psychological Association until it was removed from the DSM in 1973. It's like one day I'm told that I'm sick, and the next day it's removed from the DSM, and all of a sudden I'm not sick anymore. I still have to do work around how do I heal from that. there's a lot of sexual shame involved with it. So that's been a salient factor with being able to kind of turn that around.
Yeah. The book is called Sexuality and Addiction, Making Connections, Enhancing Recovery. I noticed chapter 11 is "Oh God," and I'm wondering whether that's an orgasmic
God.
"Oh God"
Yes.
or whether that's a spiritual
Oh,
"Oh God."
yes. It's not about
Oprah.
It's the O. The big O.
That's what I figured.
The interesting thing was when I met Dr. Bill Staten, who was the director of the Human Sexuality Program. He was a Baptist minister. He's a Baptist. He had a PhD, a theology, so his doctor was in theology. And talk about an area that you think, well, this isn't a match. I think that would be congruent. You know, here's a Baptist minister who we have stereotypical ideas about, who embraces his sexuality and is open about his sexuality and embraces that spiritual component. Because I think when we're harmed, and we're harmed by sexual messages, and we're shamed by sexual messages, it kills us inside. It kills off that spirit part of ourselves that we might have lost touch with through our numbing, through substance use, to not have to feel that way anymore. And so being able to reconnect to that center of ourselves. There's a sexual health model that I work off of, and it was adapted from one that's can be found on advocatesforyouth.org's website. But I adapted the model and included a center circle, because all the circles in that sexual health model are connected. But for me, one of the pieces that was missing from that model was the spiritual piece. You know, how do we reconcile from the harm that's been done to us to be able to recover and be able to heal and get reconnected with our spirituality in a way that makes sense for ourselves.
Raven James joining us on Recovery Coast to Coast, making connections, enhancing recovery, sexuality, and addiction. When people sober up, especially if they are single and they have to go out in the world, sexuality is a big thing, and doing it sober, maybe for the first time.
Yeah, and there's so much more risk today. Well, it seems like there's so much more risk today with there's a lot of viral infections that weren't around back in the 60s and 70s, and, you know, when some of us grew up.
What about safer sex?
Safer sex is really important. And thinking about HIV and be able to be comfortable talking with our partners, but as a counselor, being able to talk to our clients about what types of behaviors that they're engaging in. So if I'm talking to clients about having vaginal or oral or anal sex and being familiar with different types of behaviors that different people engage in, I have to have that comfort to be able to provide them ways to be safe that are meaningful to them, rather than making an assumption that, oh, well, I have this female client and she's married to a man. That doesn't mean that she's heterosexual. They could be in a polyamorous relationship or an open marriage. She could be bisexual. There's a lot of variables that when we make assumptions about people when we meet them, and rather than asking the questions and having them be able to be open to tell us who they are, then I can provide more appropriate interventions for you based on the types of behaviors that you might be engaging in.
Talk about healthy sexuality. It's different for everybody, right?
Yes, it is. And I think the healthy sexuality piece has to do with what's congruent for you. So how does it make sense for you in your world? And what are the pieces that have been harmful for you? I have to have that conversation. I have to have a way to be able to assess that when you come into treatment and listen to your story, honor your story, and then be comfortable to find ways in which you can kind of reconnect with yourself.
Is it difficult for patients to even talk about it? I mean, there's so much repression for so many years. You can't just sit down and start talking about it. It takes a lot of time, I would think.
It can take a lot of time, but one of the things that I found over the years of working with folks is that oftentimes there's a reluctance on the part of changing policy within an organization or including it as a standard part of treatment. One of my colleagues who wrote the foreword for my book pilot tested a sexual health intervention at a substance abuse agency in San Diego in California, Stepping Stones. His name is Douglas Braun Harvey. And this is turning into evidence-based practice where all the clients who came in, they were assessed. So if there were linkages between sexuality and why they used or why they relapsed, they were able to go through a sexual health group. Well, they increased their client retention by over 50%, and clients, they stayed in treatment longer, and they reduced the levels of sexual shame to levels of clients that didn't have sexuality and linked issues. So if we don't assess for it, we don't know that it's an issue. If there's no issue, we don't have to worry about that as a relapse trigger
Yeah,
or a
'cause I
treatment
would
issue.
think, it could be a slippery place for people.
Yep.
Yeah.
But if it's a standard part of assessment, when people come in and we say, well, this is it for the client and oftentimes for the counselor, it's a way to normalize because human sexual behavior is normal.
One of
That's
the things
why we're all here, right? Somebody had to have sex.
Absolutely.
But
Somebody
let's
had to
not
go to
talk
that sex
about it.
camp. I'm telling you what.
No, they had
I
it
noticed
somewhere.
in the book is you have a sexual history intake questionnaire.
Yes.
Which people can take. If they take the questionnaire and they come up with some results, what's the next step?
Well, the next step, and in terms of the questionnaire in this book, is more for counselors to look at what else do they need to know about and where are the areas that they're uncomfortable with. Because we're not saying that a counselor would be able to necessarily work on every single issue with a client that they came in with, but at least they would have an awareness of what their boundaries were. And that maybe I'm okay to work with people who were victims of sexual abuse, but I haven't done my own personal work, so I don't want to work with perpetrators. So it helps a counselor be able to kind of look at their own knowledge base and their attitudes and what internal work they might need to do for themselves, and to be able to work with another counselor, get supervision around that, get therapy around that themselves, because it's about knowing thyself. And so I can't help you heal if I'm still kind of harmed inside for the same issue.
What's the role of families in all of this?
The role of family, again, addiction harms us in many ways, and I think it estranges us from our families, or it can estrange ourselves from our families. I work with clients who relapsed, and they were so, like this one client I had to notify his family. They were in another state, and he died on a relapse, and he wasn't connected with anybody. And he had people in recovery who were his new family, but bridging some of those gaps, I think that takes time, and it might not necessarily take place in treatment. But one of the biggest pieces that's important is figuring out, having that awareness, kind of that here's the holistic picture, here's all the things that can be linked, and here's some things we're going to maybe include in your treatment plan or your relapse prevention plan. And you might not deal with them now in treatment, but you might, again, like ongoing recovery support, recovery coaching, that some of these are going to come up for you later, and that I'm able to provide you resources with where to kind of get assistance from somebody who's gone through the same thing, or can also, now you're ready to hear it now, because I have to do my own self-healing before I'm able to go to a family member and maybe make amends, or kind of try to resolve some issues that we might have had. If I was harmed by my family around, say, sexual identity because I grew up lesbian or gay, it's going to really depend on if that family is open to embrace me back into their life.
We are here at the 40th Annual NAADAC Conference. Is it usual or unusual for treatment centers to deal with sexuality?
From my experience, the norm not to deal with sexuality. Push it under the rug.
Is that a good thing? I mean,
it's not a good thing.
It's not a good thing, even in early recovery.
No, because we have to be able to, when clients are having multiple relapses and we don't assess for sexuality related issues, and this is the reason that they're relapsing, we're essentially contributing to ineffective treatment outcomes. And so just to be able to bring it up as this is matter of fact, these are the questions that we ask everybody, and then have a venue within the treatment program when the client's ready. We're recommending around 30 days of recovery to start a sexual health group, that it can be a really good adjunct, once they kind of get stabilized, and have it, as an awareness piece of on their psyche.
Spot on. The book is Sexuality and Addiction, Making Connections, Enhancing Recovery. Raven James is the author. You can find it at Amazon.com. It's really a good read, and I encourage you to check it out. I thank you so much for your time.
Thank you.
I'm Neil Scott, the program Recovery Coast to Coast. We are delighted to be at the 40th Annual NAADAC Conference, the Association for Addiction Professionals. We'll be back with more right after this.